Hello everyone. We are actually observing the Retinoblastoma Awareness Week this entire week, and in honor of that, it's important that we should talk about certain basic things about retinoblastoma which everybody may not know about with respect to this Facebook Live session, and we'll also be discussing whatever questions crop up in between. So you may or may not have heard about retinoblastoma, but basically what it is a tumor of childhood which involves the eyes. Now, how do you know if you should be worried about it or not? So, risk factors for retinoblastoma are, of course, if either of the parents have retinoblastoma. But the issue with this is that most people or children who develop retinoblastoma, they get it from a genetic mutation. So it may not be something which they even know about that they could be predisposed to. So it can happen because of an issue with their genes. Now, if one of the parents do have retinoblastoma and it is because of an inherited cause that the child is developing it, they could have retinoblastoma in both the eyes, and this is a big issue. Now, what is retinoblastoma? It's basically a tumor which arises from the cells of the retina, that is the nerve layer of the eye. Now, because of this, some of the signs which can take place or which parents may notice and then bring their child in for an examination are if there is a white reflex that is in the black part of the eye. In the center there's a pupil. If that pupillary region, instead of appearing black as it does normally, in case it appears white, that is a white reflex. In case the vision is affected in that eye, so a child with retinoblastoma, if the tumor is big enough or affecting the center part of the retina, definitely the vision can be affected. And if the vision is affected, consequently, there can be a squinting of one of the eyes as well, if one eye is affected. So parents would notice that one eye is sort of deviating from its normal position and that there is a squint. And that would be one of the first reasons why the retinoblastoma would be diagnosed by the ophthalmologist. Another thing is that if the child has redness of the eye. Now, any child can develop redness because of viral infections or because of any trauma or injury to the eye. But if there was a trivial trauma or there was no actual cause for the redness, this could be one of the issues leading up to it. So if there is redness also, it's important that you show your child to the ophthalmologist. Rarely in retinoblastoma, the eye can shrink as well. That could also be one of the things which can be seen. And in severe cases or fairly advanced situations, the eye could be protruding. That is, if the retinoblastoma has gone outside of the eye and involving the extraocular structures. So how does the ophthalmologist diagnose retinoblastoma? So once the child comes in, the basic tests are done. So we look at the vision, we look at all the other slit lamp findings, that is the clinical examination, and from there you can get a fairly good idea. Along with that, we would take into account the history of the parents as well. And then there is a certain ultrasound called a B-scan ultrasound, which is done again by the ophthalmologist in the eye hospital itself. And that can also give a fairly good idea. If required, they may advise an MRI. So MRI would need to be done with the child, of course, in a bit of sedation. But the MRI would tell about the extent of involvement of other parts around the eye as well, involvement of the brain, etc. Now, once it is suspected, the child might need further tests such as blood tests for maybe a genetic evaluation, which is again very important. They may need a bone marrow examination, as the bone marrow can be affected as well, a lumbar puncture for a spinal tap. And if any eye removal surgery is done, then the pathologist would have a look at that specimen to tell about the staging and the grouping of the retinoblastoma. However, the grouping can be done clinically. Now, the other things are that we've of course discussed the risk factors, but the genetic testing is also quite important. So what it does is help people who are planning a family who have a retinoblastoma history to sort of take into account the risk or the percentage of risk that is there if their child is born for them to have to develop the retinoblastoma. So a genetic counseling is extremely important before planning a family in somebody who already has retinoblastoma. And of course, the first child has it, then before planning the second child, again, it's very important. Now, retinoblastoma, as I said, can be clinically grouped and of course staged based on the involvement, and also histopathologically staged as well. And the various treatment options that are available for it are basically chemotherapy, that is intravenous or intraarterial chemotherapy, or intravitreal chemotherapy, that is directly in the eye. And there are various laser treatments which help to shrink the tumor, that is by doing a laser through the eye itself. And there is a cryotherapy as well, which tends to freeze and kill the cancer cells. Of course, there is a surgical management as well, that is in advanced cases to remove the eye completely. And of course, radiation is also one of the treatment options in slightly advanced situations, or wherever deemed necessary. The different types of radiation are also possible. Now, what are some of the side effects of these treatments? So, chemotherapy itself has its own set of side effects, which can cause various issues in children for which they are monitored, like for example with the hearing, etc. Radiation again has its own set of issues in case it is done. And of course, with respect to eye removal, if that is done, then there would be a socket left behind with an implant, and the socket would need to be cared for separately with eye drops, etc. And of course, a prosthetic eye or an artificial eye would be placed over that implant that is in the empty socket to give the appearance of the other eye, but only for a cosmetic purpose. There wouldn't be any vision in the other eye. Now, once retinoblastoma has been diagnosed, it can definitely be treated based on all these treatment options that I have mentioned. And in case it is involving the vision, yes, the vision does get affected if the center part of the retina is involved, and that would have to be treated accordingly. But some of the vision can be salvaged, that is the first stage. Sometimes the retinoblastoma can shrink with treatment, and then the globe or the eyeball can be salvaged, so you don't have to remove the eyeball. But if it does involve outer parts or beyond the eye, then the point is to salvage life, and for that you would need to get rid of the tumor completely. If it involves getting rid of the eye, then so be it, and the rest of the treatment as required by the pediatric oncologist and the ophthalmologist. Now, with respect to monitoring, once the retinoblastoma has been fully treated, even then children would need to come back every 3 to 6 months back to their ocular oncologist, who's a type of oculoplastic surgeon, a specialized ophthalmologist, who would keep screening them every 3 months initially, and then every 6 months to make sure that that eye is doing well, or that socket is doing well, and to screen the other eye as well, because even with further genetic mutations, the other eye could get involved later on in life. So it's important that this screening process continues. So this was a basic overview of retinoblastoma, and I hope I've given you some kind of idea of what it is, what kind of treatment can be done, and what to expect if a child is diagnosed. So after this, I can take a few questions. if yeah. So we have a question now that how often should children be monitored for recurrence or late effects? That's what I've just mentioned. That is around every 3 to 6 months or so, and also depending on what is found in that particular examination. Every examination is done under anesthesia, so children would not be able to cooperate otherwise. So a short general anesthesia is given by the anesthetist, and the child is made to lie down, and the ophthalmologist or the oculoplastic surgeon, that is the oncologist, has a look in the eye and also the other eye as well, to make sure that how the eye is doing at that point. So that would be decided by the ophthalmologist. Now, are there any support groups or resources available for families who are dealing with this diagnosis? So yes, now in India there is definitely a paucity of support groups and things like that. However, there is a Fight India Retinoblastoma helpline, which basically is 1-800-123-6272, and that is run by the cankidsindia.org. Okay? CanKids, CANKIDS, CanKids India. And what they basically do is they help you tie up with a social worker and give you the kind of support you need in case you are faced with this diagnosis. And also there is an Iksha Foundation, which basically provides monetary support to families who cannot afford retinoblastoma therapy, because it is of course a very expensive affair, especially if you consider newer modalities like intraarterial chemotherapy. These are expensive treatments in India, and what they basically do is they try to cover the cost of treatment as far as possible. So these are basically the most common resources available, and most of the large hospitals around India, such as AIMS or LV Prasad in Hyderabad, they do have some amount of allocation for free treatment for these children. So that's something which is quite heartening. So next question is, can you explain the importance of genetic testing? So genetic testing is quite important because it gives you an idea of the kind of inheritance. Now, like I mentioned earlier, if the child has a heritable version, that is the one which is passed down through families, that would be a more severe one. And in case it is more severe, that is the bilaterally involving one, can involve a part of the brain as well, and it can spread also. The other thing is, it predisposes you to other types of cancers as well in the body. So these are the more severe ones. So in case you're able to do some genetic testing and genetic counseling prenatally, that is before planning children, that would be ideal to prevent any of these kind of situations from cropping up. So how does retinoblastoma affect a child's vision, and what can be done to support them after that? So retinoblastoma in certain stages or groups can definitely affect vision, and if the surgeon is able to shrink it or make sure that it is not in the center of the eye, if it was initially there, or if it is shrunk there, definitely the patient can have some amount of normal vision, or they could have defective vision, or they could have no vision at all. So no vision at all would be just a perception of light if the tumor has sort of destroyed that area where the maximum visual perception is, or of course if the eye is removed. Now, with respect to the eye being removed, the other eye has to be screened, like I mentioned, to make sure that there are no issues in that eye. And of course, polycarbonate glasses being used so that the other eye is also protected. So that is very important. And with respect to the low vision, in case there is low vision, there are visual aids and magnifiers, etc., which the child can use in case they are having difficulty with doing their daily activities. Of course, if the other eye is okay, they would still be able to manage relatively well. So, are there any advancements or promising research in the field of retinoblastoma treatment that parents should be aware of? So, yes, retinoblastoma is actually something which is being researched at a very fast pace. So, it's people are trying to figure out how to get better and better drugs, improve the drug delivery to the eye, especially in intraarterial chemotherapy. And the most promising of all is stem cell therapy. So there have been vast strides in research for retinoblastoma with respect to the markers and how stem cell therapy could help in these children, in order to treat the retinoblastoma. So yes, there are definitely advancements which seem to be just around the corner. And as soon as we hear of something which happens, or if we are involved ourselves, we would definitely convey that. How do you approach the management of a child's pain and discomfort during retinoblastoma treatment? Now, this treatment is actually can be very difficult for children as well as the parents, because they have to repeatedly go to an ophthalmologist again and again, get anesthesia, get treatment. And I wouldn't say it's too painful of a treatment, but yes, undergoing the side effects of chemotherapy is definitely painful. And there are pain medications which are administered to children as well, under, of course, the ocular oncologist, the pediatric oncologist, and of course the pain specialist. So these are sort of treated in a multidisciplinary approach, and it can be managed well. And of course the support group that I mentioned. However, more support groups are needed in this regard, because there are quite a few children in our country who are afflicted with this condition. So the last message would be to be, of course, vigilant, and to make sure that a child gets screened every year for their eyes, so that nothing is missed, and even basic things like glass power, etc., are diagnosed early, so that children can get the best possible visual development. So this was all about retinoblastoma, and of course you can comment in the comment section for any other questions which we may not have addressed. And of course you can come to us at any time after taking an appointment to visit us for any eye consultation, or if you have a doubt in this regard as well.